get ready with me, just skincare version. I already cleaned my face, washed my face with SkinCeuticals Gentle Wash. It is the only face wash I've found that doesn't dry me out. I have oily combination skin on top of the PCOS. I'm now toning with the SkinCeuticals Equalizer Toner. I've been using this skincare routine for about 2 months now, and I've noticed a big difference. Then I go in with their Phyto A brightening treatment. It says 1 to 2 pumps. When I first got it, I was using like 2 to 3 pumps, and I blew through it. So 1 pump is suffice. This is supposed to help with brightening as well as scarring. It's got a few other things that it does, but I'm not an esthetician yet. I'm going to esthetician school next month. But I am a licensed massage therapist, so you will see me kind of do a massage on my face as I put everything on, because that's just natural for me. I don't know how to just slather things on. I have had PCOS for, let's see, I got diagnosed in 2016. I think I had it before then. It just took me a while to get diagnosed. I used to have huge cysts, ovarian cysts that would like literally keep me in bed for like a week. It felt like I got hit by a train. My whole abdomen side to side would be just rock hard, swollen, painful, everything. And when I would go to the doctor, they would basically just say, take Tylenol. This was the SkinCeuticals Retexturing Activator. It says bifunctional resurfacing and replenishing serum. So it is a serum. I would go to the doctor and they would do sonograms and find all kinds of cysts all over, and they would basically just tell me I had to wait until they ruptured. There really wasn't anything else they could do about it. I didn't really struggle with acne until about 2019, 2020. I was in a really stressful relationship and a really stressful job. So stress is terrible for PCOS, and it really killed my face. I'll try to find some pictures. This is the SkinCeuticals CE Ferulic. It's their vitamin C serum. It has taken me many, many years to combat the damage that was done to my skin. Being a licensed massage therapist, I worked in spas, so I started really caring about my skincare, what I was putting on my face, and a lot of it still was happening. A lot of my breakouts were still happening no matter how many facials I got. It was really an internal thing, and the internal thing was stress, because the minute I combated my stress, it was night and day on what my face did. This is my moisturizer. It's Elastin. Ultra Nourishing Moisturizer. It is a little expensive for a moisturizer, but it feels great on my skin. I really have enjoyed it. I've been using it about 2 weeks now. I don't love the smell of it. I'm gonna be honest, it doesn't smell the best. But it's got Tri-Hex technology, which is supposed to help your elastin and your collagen. Another reason I really massage my face when I'm putting my product in is so that it can really be absorbed, as well as move these facial muscles around, because our face gets so tight all day. We have lots of facial expressions, especially if you're very expressive, and your face just gets like knotted up in those areas. And so it's really important to try and release those muscles. So I try to like stretch around all of my bones, really manipulate that. And then my final pass, I like go through, I always move in an upward motion because our face naturally hangs down because of gravity. So moving upwards as much as possible. And then I come around my lips. It looks really silly, but I basically manipulate this muscle all around my lips and I just kind of fold it out. Right here in the corners gets really tight for me. So I'll kind of just massage that. I'll squeeze them out, do a little pinch. And then anytime I'm working in the eye area, I use these fingers, the ring fingers, because they get used the least amount. And I always go out to in because it's really easy to stretch your skin out and cause further damage to your eyes because that's such a sensitive area already. So I always go out to in. Same thing up here. And then on my brows, I go up and give myself a little natural brow lift because this muscle gets so tight from our day-to-day facial expressions. I go up here and then I move to my next brow. I have had a brow lift, Botox, so I'm not going to say I haven't done any work. That is all that I've had is a brow lift, and I just got that recently. And I probably won't get any other work done. I'm happy with the way my face looks right now, other than my acne. So now that I've done a full routine, I'll show you what my skin looks like. As you can see, I'm a little red. I have some congestion here, a little bit of congestion there. Most of my congestion that I get is all right here. Like that is like the worst part of my PCOS. So you can see that a little bit underneath the surface. I've been getting hydrofacials every 2 weeks for the past 2 months, and I would say they help, but I struggle so much because it brings so much to the surface and I have so much deep, like embedded, that when it comes to the surface, it almost makes it look like my face is worse rather than better. I am getting a skin pin with exosomes done in next week. So hopefully that'll help with a lot of the rejuvenating, like resurfacing, bringing the rest of this shit to the surface. And hopefully we can get rid of this because my acne is my biggest insecurity. I absolutely hate it. I have struggled for so long with it. I used to try to cover it with makeup. For years, I didn't even care. I just stopped doing anything to it because it was so bad. It looked worse to cover up with makeup. I have 2 kids. Once I got pregnant, the ovarian cyst stopped. I have not had any cyst rupture or cyst pain in 3 years now. My oldest child is 3. And I know that they say pregnancy can combat like a lot of PCOS symptoms. And so it really did change for me. Like I don't get the cyst anymore. But after my second child, the acne has come back like full force. As you can see, like the congestion here, like I got put on a medication and it gave me a full PCOS flare up, like full on, out of control. My chest was so broken out, my cheeks. Basically, this is my skincare journey. I have always wanted to be an esthetician. in Texas. I'm from Texas, and it's a big deal to, or very common, not a big deal, but very common to be dually licensed, to have your massage therapy license and your aesthetics license. And so I've wanted to become an esthetician for a very long time, but then I had my babies, and it just was not the right time. And it's the right time now. So I start school next month, and not only am I excited for the journey of being able to give facials. Like, I love hydrofacials, what they do to the skin. Like, I want to go into more of the medical aesthetic side of it, especially coming from the background of having such deep, painful, terrible cystic acne. But I'm mainly excited to just learn how to take better care of my skin. Like, I feel like I have been doing a pretty decent job. I've really tried to learn every time I've gotten a facial. I get a facial done by a few different estheticians, and I just try to learn as much as I can. But I am ready to learn how to not pick, or how to extract the correct way, because I am a picker, and so I do have some scarring up in here. But I'm excited to just learn how to take better care of my skin, and hopefully it'll get better.